Why is symmetry so important? And why are we never going to get there? Dr. Nicholas Mercer with uImproved PT. So, human body has two sides. So, you would think that we need to be perfectly symmetrical. And it makes sense. If we're doing a movement that what we call bilateral, where it basically looks the same on both sides, we want to look as symmetrical as possible. However, humans are not made to be perfectly symmetrical. This is why we choose one side over the other. We are either right-handed or left-handed. Even if you are perfectly ambidextrous, I challenge you to try to get your heart to be aligned right in the middle, or your right lung to be the same size as your left lung. The human body is clearly not perfectly symmetrical. But if we are too asymmetrical, we can get a lot of pain and dysfunction in our body. So it's really important to remember we want to move towards symmetry in all of our movements, knowing that we are not going to get there. Even in movements where the right and the left side look different, so a split squat or walking or climbing upstairs, or really most of our movements, we want to make sure that when we do them on one side, it looks very, very similar to the way we do it on the other side. This can actually be a good indication on if there's a real problem, or if you're at risk for pain, or even the reason why you're having pain. If one side of your body is taking more of the brunt or more of the stress and strain from your everyday life, it is going to cause a lot of detrimental effects on one side of your body. It's not always the side that is taking more of the weight. Occasionally it's compensations from the other side that are causing you pain. Now, again, pretty much everyone is a little bit asymmetrical, but in order to go on with life without pain, without dysfunction, we need to be as symmetrical as possible, or at least being mindful of that symmetry and moving towards symmetry. And one place where I see a lot of asymmetries and where asymmetries will pop out, rear their ugly heads, cause pain and dysfunction is in the hips. Specifically, the pelvis, the level of the pelvis. A lot of times we will see in people with lower back pain or hip pain or even knee pain that their hips are not quite level. And sometimes this is due to anatomy. Sometimes people have an anatomical leg length discrepancy where one leg bone is actually longer than the other. But more often we see a functional leg length discrepancy in which the length of the legs appears to be different, but it's because the pelvic bones are rotated off in an asymmetrical way. And this could result in a lot of different types of pain on one side of the body, depending on how the person compensates. But that's kind of an indication is we will see it on one side of the body and not the other, and that's when we really want to be mindful of our asymmetries. So I'm going to show you how you can kind of quickly determine if you're more likely to have one of these pelvic tilting asymmetries, especially lateral pelvic tilt, and one kind of method you can use to try to get it back to symmetrical. Again, knowing you're probably never going to be perfectly symmetrical, and that's okay. We call this the shotgun method because regardless of what is causing the pelvic tilt, this is a good way to just reset the pelvis. Again, we're not expecting perfect symmetry at the end of this. We're expecting a decrease in the amount of lateral pelvic tilt, and hopefully a reduction in your pain and dysfunction. So first we have to make sure that you do have this lateral pelvic tilt. And the way we're going to do that is taking your thumbs and finding what we call the anterior superior iliac spine on the front of your hips, is that little bone that pokes out. I usually have a little bit. My left is usually a little higher than my right, and you can see that here, right? So, yay, I'm asymmetrical. So are a lot of other people. But we can try to use the shotgun method that I'm about to show you to get those a little bit more level here. All right, so simple shotgun method. All you're going to do is let those legs come up, fists just like this. We're going to push into your fists. We're going to activate the adductors, holding for 5 seconds. And then we're going to bring the hands on the outside, pushing in, pushing out into our hands to activate the abductors. Pushing in, we're going to do that 5 times, right? So holding 5 seconds, pushing out, holding 5 seconds. Keeping your belly a little bit tight. If you feel kind of a clunk in your pelvic region when you do this, we may have reset your pelvis, but if you don't, that's fine too. We don't always hear a clunk, but if we do, congratulations. All right, so once we've done that 5 times, one hand is going to come to the front of one knee, the other hand is going to be on top, and we're going to push down and push up. So we're going to resist, hold 1, 2, 3, 4, 5, switch 1, 2, 3, 4, 5. Again, we're going to do this, you guessed it, 5 times on each side. Keeping that belly a little bit tight throughout this whole process. Again, if you feel a clunk, cool. If not, also cool. All right. And then after that, you want to stand up and see if the ASISs are just a little bit closer together, a little bit more symmetrical. So try out that shotgun method, see if it levels out your hips a little bit more if you do have that lateral pelvic tilt where one ASIS is higher than the other. Make sure you go to uimprovedpt.com for more free information on ending pain. Make sure you subscribe to our YouTube channel. We are going to be releasing complete solutions to your problems with specialized tests and solutions to each of your deficits in order to get you back to the life that you want to be living, active, without surgeries, without cortisone injections, and without pain meds. So make sure you subscribe so you'll know exactly when those come out, and so you can see all of the good free information that we're putting out every week through our YouTube videos. Again, if you feel like your hips are a little off and you're experiencing some pain dysfunction on one side or the other, try the shotgun method. Hopefully it helps you out so you can move more, pain less.